Great. Well, I'm so excited to start this session with Dr. Stephen Swenson. And this is part of the Arizona Community Grand Rounds. And we have a super interesting and exciting topic that we're going to be discussing together. Our person who is running the webinar has said that this is the most signed up webinar that we've had so far for Arizona Community Grand Rounds. And so I'm thinking that kindness is one of those types of organizing principles that everybody's interested in. We have a very distinguished speaker today, Dr. Stephen Swenson, and this is going to be like a conversation between the two of us. And so I'd like to introduce him first. You do have a slide that shows some of his current titles, but Dr. Stephen Swenson is a longtime researcher and distinguished clinician who has been using the principles of kindness in his work with various different organizations, including serving as for the 35 years at the Mayo Clinic as a director for leadership and organizational development. He has worked extensively on professional fulfillment and has overseen the development of a professional fulfillment initiative at the Mayo Clinic with over 4,000 physicians and 232 key leaders. He was the chief quality officer. He also has established a quality academy wherein 37,000 colleagues were certified as fellows. He's co-authored or authored 3 books, more than 200 articles, has had 2 National Institute of Health grants, and has earned some honors such as the Diamond Lifetime Achievement Award, and has served as past president of 2 international societies. He has been married for over 47 years, has 2 children, and completed 39 running and cross-country ski marathons. So we know that he's very disciplined as well. So I want to welcome you, Dr. Swenson. Well, you and I have met together, so I'm just going to call you by your first name.
Right.
And I guess I'll introduce myself real briefly too. I'm Dr. Teresa Birch. I am the Chief Medical Officer and Chief Wellbeing Officer of the NARVA Institute, which is one of the sponsoring organizations of the Arizona Community Grand Rounds. So welcome, Steve.
Great to be here with you, Teresa. Looking forward to our conversation.
Yeah. So maybe to get started, can you tell us what got you into this field in the first place?
Well, when you look at the whole healthcare system and society, the places that work the best, no matter who you're serving, start with the patient, the family, the community, and work backwards from there. And in those settings of those organizations that flourish, not only do they start by treating the patients and families and communities with kindness, and patients' physical wounds heal faster if they perceive that their caregiver team of nurses and all of the staff treated them with kindness. So it has powerful physical and emotional ramifications for human beings.
Mm-hmm.
And so it makes sense that, and we know from decades of really solid research, if our caregivers, the staff from social workers to NPs and PAs and nurses and physicians and managers and pharmacists, the whole team, if they are connected to their work as a calling, and if they're connected to patients and each other with kindness and with a spirit of camaraderie, that patients get better care, their care costs less, it's more effective. And so the whole environment just makes sense to look at the human beings and their full potential at all places in the ecosystem.
Yeah, and so how is it that you came up with kindness as an organizing principle? I've always been impressed, like with sociologists and different researchers that look at human systems, about how they're able to parse out all these different components and then roll it up into an overall theme.
So the work that I did at Mayo with our team, everything was team-based at that organization. It started with how can we improve psychological safety on multidisciplinary teams, and how can we improve engagement and camaraderie? How can we reduce emotional exhaustion and depersonalization of burnout? And then I got involved through my work with the Institute for Healthcare Improvement, where I'm a senior fellow, with some international work in Sweden. And so that the same kind of ideas that we were looking at for improving the camaraderie and the morale and the esprit de corps of staff taking care of patients and families and communities, we looked at across the whole population of a region. So not just patients, and we looked at all the social determinants. And for that, I did some research that looked at, I think, 378 peer-reviewed articles on at the intersection of what I call the good life. The good life, I'd submit for at least our conversation today, is this aspiration to have a fulfilling, meaningful life with as long of a health span as possible. And so health span is the subset of lifespan, that it has good quality of life. And so if you look at optimizing those two human characteristics of optimal health span and optimal fulfillment and positive life outlook, I identified 54 determinants in this robust international literature.
That's a lot.
You looked at them, you looked at each of them, they all were involved helping people become better. And that's how I define kindness, is helping people be better. And some of those 54 determinants, about a third of them were what societies can do. And the societies that have the highest level of happiness and fulfillment also have the highest levels of health span. There are determinants like trust in your neighbors, trust in government, and then elements, the countries that are happiest and most fulfilled and have the longest health span have the highest level of social equity and gender equity, and they have the highest level of personal and economic freedom, and they have the highest level of access to good quality education for everyone in the population. And so then when you move those acts of kindness by societies to the citizens, to look at the organization level, you found the same thing, and with different actions. And so the organizations that flourished and that had the most engaged staff, that were most likely to stay and most likely to use their discretionary activity and time for the mission of the organization, and looked at their work more as a calling than a career, than just a job, they tended to look at these acts of kindness for all of the staff. And they fall into four categories: agency, control over work life; collective effervescence. This is the meaning and purpose and the harmony and energy that humans get when we come together on a shared purpose; camaraderie, the social connectedness; and then positivity. And all four of those characteristics, innate needs of human beings, if they're met, we live longer, those years are higher quality through our own eyes, and we're more fulfilled and happier and have a higher subjective well-being. So that's kind of how I have my journey to get to working with organizations that have a big role in human well-being, whether you're being served as a patient and family, or whether you're working in that service.
So I would assume that many leaders think that they're naturally kind, and that maybe they don't necessarily have an evaluation of their organizational kindness. But what would you say to those organizations or those leaders about the value of having a more explicit strategy for kindness. You know, like almost like a checklist in their head, like these are the kinds of behaviors that are kind, these are the kinds of systems that are kind, so that they can actually more intentionally implement kindness.
Yeah, I love that question, Teresa. So in Sweden at the Karolinska Institute, and the Karolinska is where they award the Nobel Prizes, except for the Peace Prize, and so they did some research on bad bosses, and those are bosses, and you
Those
know,
are not the bosses we ever want to be.
that's right, and they're so these are leaders or managers that basically don't lead with kindness and don't lead with empathy and don't. And it turns out those people who have that kind of leader that you might call a boss, and particularly a bad boss, have a higher rate of heart attacks and they die younger. And so it has, leaders matter, and the behaviors of leaders matter. What we did in our work for it started close to maybe 18 years ago. We started measuring 5 leader behaviors. And so we would survey all, I think now about 75,000 staff in all of our 23 hospitals, nurses, doctors, pharmacists.
This is at the Mayo Clinic?
Yes, it's Mayo Clinic. And accountants and custodial, environmental service professionals, everybody. And we asked them 12 questions about 5 behaviors of the leader manager to whom they reported. And we published these results in 2 different renditions. But we started with physician leaders, and it worked so well, we scaled it to the 3,300 point of care leaders beyond that. And what we found is that more than anything else, more than the strategy, more than parking spaces, more than benefits and salaries, and more than anything else, those leader behaviors have the biggest impact on staff morale, particularly staff satisfaction and fulfillment, and in a positive way, and also the most very strong impact on professional burnout in going down. And so it was, and it was the single most important determinant of employee well-being compared to all the other things that were measured. And so these 5 behaviors, I think, are all acts of kindness, and they are so simple. But to your question, Teresa, we can measure them, and people, if they choose to and want to, can improve their the morale of their work unit, and they can improve the staff's assessment of their delivery of and behaviors of those 5 acts of kindness. And I'll just quickly run through the 5. Sure. The first is, does your leader recognize staff and show his or her gratitude and appreciation for work well done? Appreciation, this positive environment, is so key to the mental, physical, and social well-being of staff. Does your leader mentor you, and is he or she interested in your career? What do you want to be doing 5 years from now at the NARBA Institute? And how can we work together for your dream to come true? The third behavior is basically listening first, listening to understand, but instead of coming in with the answer for where we need to go, northwest at this speed, or even if that's the right answer, that the best leaders first seek to understand, they listen, they engage the staff in a collective conversation and decision-making process. Maybe the most important of the 4 is that everyone on the team, regardless of phenome or genome, gender or color, or any of the beautiful rainbow renditions of human beings, feels welcome and respected. And that this is a way to measure that, and that the climate of each of those units. And then finally, the transparency within confidential guidelines. Is your leader open the books and communicate transparently so that we can all do this together and make better decisions together because we're working together? So those 5 behaviors are not rocket science. They're common sense, and if they become common practice, patients and families and communities do so much better.
You know, I have seen some reluctance by organizations, especially leaders, to measure themselves and measure their organization. There's some, you know, like whenever there's discussion about 360 performance evaluations, you know, people start to get a little uncomfortable. I've been really impressed with the Mayo Clinic and how open it has been with measuring uncomfortable, potentially uncomfortable evaluations by the staff. And especially as we're now in this new maybe period in our society where there is a lot of discussion about equity and participation. At the same time, there's this tension of potentially like negativity that's out there. Can you speak to some of that and maybe what you've learned along the way?
We have to measure what matters to us, and every organization, not for profit or for profit, measures money, and that's fine. You need to have a margin to keep the doors open. And if we say that culture is important to us, and if we say that the well-being of staff is important to us because it improves the results and for patients and families, then we have to measure it. If we're serious about it. Otherwise, it's just lip service that's hollow. So the video has to match the audio.
Mm-hmm.
And if you look at the list of the most important drivers of culture and well-being, it's leaders, and the leaders closest to the patient, or if we're outside of healthcare, whatever the customer is within the health space. And so, and then more specifically to your question, sure. It's uncomfortable for a lot of people to be measured, particularly on leadership and cultural things and behaviors. But leadership is a privilege, and it matters so much for the thriving of people and the success of the organization. If we're serious about that, we have to measure it. And when we first rolled this out, we knew that was a sensitive issue because we started with physician leaders, and all of our physician leaders still see patients and practice medicine and surgery, and so and they do that. They can do that, be a leader and remain clinically active with a partnership with an administrator and a nurse and a dyad or a triad. So we rolled it out slowly, saying, here are these 12 questions about these 5 behaviors. And we're going to be asking all staff about their direct report leader about those behaviors. And the spirit of this is, we want to help you become a better leader. And the spirit of it is not, we're going to rack and stack, and if you can't get a passing grade, then so we rolled it out, and then I would sit down. At the time there were 41 department chairs in Rochester. I sat down with each of them, showed them. It turned out to be a bell curve, and each of the dot represented their staff's assessment of their leadership on those 5 behaviors, and almost all of them said, all right, I can do better. Can you help me do better? And and rarely there was a leader who didn't think that was the right thing to do, or didn't care, or maybe couldn't, improve those behaviors. And so we found another role for that person, because because he was hurting staff and patients.
Finding another role. We found another role for you.
Right.
I think that's what people are afraid of.
Yeah, well,
Might disrupt.
At least in our system, all the physicians were still practicing, seeing patients, and so it wasn't as big. You're not being fired from the only role you had. But yeah, no one, everyone has some fear of failing or not meeting expectations. And so
Mhm.
the vast majority of people would say, yeah, I want to be a better leader. I understand this works and help me. And sometimes the measurement of those um, behaviors, it's not specifically related to that leader all the time. Sometimes there's some other issues going on. And so we
Yeah.
need to, as leaders of leaders, first seek to understand to make sure there's not something else that's poisonous in that group or toxic or a relationship with another group. And so we never assumed it was always just this leader's opportunity. So we would visit them. That's why I visited with them. Sometimes it was another member of the team or some other issue. So surveys are really, really important. They're absolutely necessary for improvement in culture and engagement and in reducing burnout. But they basically just produce a heat map and say, here's an opportunity for improvement, and here's an exemplar. Let's see if we can figure out what they're doing so well that we could learn for other groups.
Well, I'm sure that you're familiar with this, but the whole likability paradox for women who are leaders, where you know, in order to succeed at work, they have to have all these dichotomies that, you know, the more they succeed at, they have to be likable in order to succeed at work. But then the more likable or the more they succeed at work, then the less likable they become. You know, how do these kinds of processes or measurement take into account maybe issues of differences in our expectations about gender or race and ethnicity, age even, and then in healthcare, the differences between physicians, APPs, ancillary staff, you know, there's so many different roles that people have and different, you know, the power structure and uh, the ideas of how we expect people to perform can be different.
So organizations that we work in are a relatively new phenomenon. You know, a couple hundred years ago, at the beginning of the Industrial Revolution, almost all of us were farmers and very few of us worked in organizations. Today, over 90% of folks in America work in corporations or companies, more than 100. And so we've had some slow, steady progress over the last couple centuries and last generation to get closer to having those issues that you are bringing up behind us, and there's still a long way to go. I remember when my wife got her first job, she worked in an area where all the women were called by their first name and all the men were called Mr. And you know, and that's, in retrospect, that was how the society was in a lot of organizations, and today that just totally. So we're making slow progress, and so what we need to do is maybe a couple things. One is we should measure that, and you measure it with surveys to get the perception of staff. Do they feel like their leader is inclusive of everyone and respectful and of everyone, regardless of phenome, genome, gender, et cetera. And then have the courage to understand and then work to improve work units and leaders where there's a confidential anonymous declaration there's a problem in this unit through these surveys. Another essential, I think, approach to is to make a long-term investment in a diverse workforce and leadership workforce. And this is in the best interest of patients and families and communities who will be well faster if they see themselves in the caregiver teams, and if caregivers see themselves in the organization's leadership. So a leadership pipeline is important, no matter how big your organization is, to have succession pools for the key leadership positions. And so for the physician leaderships positions, we had at the time I was doing this, we had 242 key leadership positions, and all of them had a succession pool, and they were rated for, the succession pool means who is going to replace this leader when his or her term is up. And we all had term limits of no more than 8 years. And the succession pools were rated for, assessed for readiness to step in, competence of the talent, ethnic diversity, and gender diversity. And we didn't set any quotas. We didn't say you had to have 17%, or we said we're measuring these things. And so just by measuring them, the incumbent leader, who has some role in the succession plan, even though that's an organization and a department-wide activity, no one wants to get a B or a C. Everybody wants to get an A. And so if you see that we're measuring for those elements in the succession pool, they say, "Oh, I hadn't thought about Dr. Bursch. She would be great.
She would be, yeah.
Yeah, she absolutely would be." And every human being has some unconscious biases, and too many of us have some overt biases, and so this helps build competence and a lovely diversity in the leadership pipeline. And we know from research in corporate America that more diverse boards, particularly whether by ethnicity or gender, have a higher collective IQ and tend to have a growth in market share and profitability more than homogeneous boards that are becoming more of the past, that were just one gender and one color.
Well, so maybe some of the benefits of the research that you've done is by operationalizing what does a good leader actually look like, so that people can be evaluated on those individual aspects rather than just a generic judgment about them. I remember when I came into a leadership position right out of residency and had all these people reporting to me. And in medicine, it's team-based anyways. And so the physician tends to be the leader of teams, depending on what the setting is. And one of my first evaluations that I got feedback about myself is that I was too bossy. And I'm like, I was really taken aback. At first I was kind of like, oh gosh, feeling a little maybe hurt, like, oh, am I being mean or whatever? And then I wait, I am the boss. So how is it that I can be thought of as too bossy? But it was good, because it did make me then reflect on what were my behaviors, what was I projecting that kind of came under too bossy. And one of the things that I realized is that when I'm concentrating, I have a face that can look a little mean. And so, being in a new role, maybe it took a lot more cognitive effort for me to be in that position. So I was constantly thinking, and I was reminded of it actually when the pandemic hit. And at that time, I was deployed from the NARBA Institute over to the Guidance Center, which is a community mental health center that has a psychiatric hospital. And so I was the chief medical officer over there, and we have the pandemic hit and trying to figure out, how do we do this? No PPE, no testing, getting COVID positive patients on our inpatient unit, having to develop policies on the fly, and things that really impacted potentially would impact people's lives, life, death kind of things, which is more unusual in psychiatry. In psychiatry, we have people who might die by suicide, which actually is still pretty rare in the big scheme of things. And so I found myself in that kind of face mode of I'm concentrating, I'm thinking, and then people would give me some feedback like, are you mad at me? I'm like, no, actually, this is me thinking. And so then I learned to like remember, like I need to maybe warn people, like this is my thinking phase. And be more conscious of that. But I think that projection that people do um, can be misread. And so having these outcomes, these actual measured qualities that people have might serve as a way to balance those underlying prejudices that maybe we have or previous experiences that we have. So I really like it for that reason.
Yeah. Well, Teresa, that's a really powerful story. And I think there are a lot of lessons in there. One is a very positive lesson is that you approach that with this growth mindset of, well, you got some feedback and you assessed it to make, see what there might be a learning opportunity to try to become a better leader. And you did, and that's beautiful. And you were also in a situation where it sounds to me, and this is way too common, there's a different standard for different, leaders of different gender and different color. And so there were some unfair judgments of you in that role that were conscious and unconscious, probably both. And so so some of these things take time in cultures and organization as we get more socialized to having different types of people in leadership roles. We still haven't had I'm not going to get political, but we haven't had a woman president in America, and that will happen. It needs to happen. And the more that we see effective leaders of all different shapes and colors and forms and phenomes, the society progresses, and there's certainly leaders who, in some of this, maybe have some gender basis to it, that and be more collaborative and more likely to listen and more likely to have a dialogue instead of just a here's the answer kind of approach. So we have to be very impatient and understand that this sometimes is more of an evolution than a revolution. But when there are opportunities for revolution, we should take that. So,
well, some of the other things that I learned from those experiences and the experiences over the years is that it's okay to be humorous. I have this sort of natural little humor that bubbles up inside of me that I think I was suppressing as a new leader, not showing that side of my personality. So just getting more comfortable showing my own personality. And making that distinction and trying to make it really clear with people that I'm tough on the tasks, but I'm soft on the people. That, I assume people are doing the best that they can with what they have. My job is to provide resources around them so that they can do really well. But then being really clear about these are the tasks that need to be done. And I think that that's kind of what your listen, sort, empower program also does, where you're taking into account what everybody's bringing to the table and what their skill sets are, and operating the top of their degrees or their qualifications, but then also acknowledging that the system has a role in making sure that they all are working well and that they are enjoying their work.
Yeah, well said. I love your you're saying hard on the task, soft on the people. And I think that when you bring humor or levity or some fun to the work team, that's an element for success. One of the four big drivers of well-being at work is positivity. And when people who work in a positive work environment, people who have a positive affect, more optimistic, have an optimistic, positive leader, they're set up to flourish at work. And the big epidemiology studies of nurses and veterans and nuns, and a longitudinal study we did at Mayo show that positivity increases fulfillment and lifespan. So you live longer. And so that's part of the work climate that we want. It doesn't, it's not, and it's a very important leadership element that you have, and that improves the effectiveness of you as a leader. And it's good to include that. Humans need that positive part in their life.
And I like your term, and I never had heard it before until you presented last year at the Arizona Wellbeing Collaboratives conference that we put on at the end of September about collective effervescence. That just sounds so fun, you know? Can you speak to that?
I love that term also. It's a collective
like soda
effervescence.
pop, you know,
Yeah.
like opening up, or champagne or something, and it bubbles up and everybody
That's how I want to
laughs.
work. So it's a term that was introduced by Emile Durkheim, a French sociologist about a century ago. And it's this energy and harmony and meaning that people experience when they come together with a shared purpose. And what better place for that than working in healthcare and
Right.
health sector, where where our shared purpose is really important. You know, the well-being of and care for our neighbors, and it gets at connecting to the meaning and purpose of our work. If you look at our life in America, half of our lives are spent at work. And so we
more
should,
than that, when you
yeah,
think
more
about,
than that.
because if we're asleep for a third of it.
Well, that's true. So more than that. So it's a big part of our
Yeah.
existence. And it's critical that we feel that work is not just a job, extrinsic reward, not just a career of achievements and accomplishments and titles, but it has elements of, or is primarily defined by, this intrinsic connection to the meaning and purpose of work. It's a calling, as Professor Bella described it. The Japanese in Okinawa, where they have some of the largest proportion of centenarians, humans who live to more than 100 years old, have this term ikigai. Ikigai means one's purpose for being. And it's another way of saying it's the calling. It's the what gets you up in the morning. And so one of the important jobs of leaders, shared responsibility with individual staff, is to connect people to the meaning and purpose of their work. And ideally it's part of this collective effervescence. So it's not, because healthcare, almost none of it is individual. It's 99.9% teamwork and colleagues and integrated. And so it's really collective. It's a collective effervescence. And just like positivity, if you look at long-term longitudinal studies of human beings, if they have some connection to meaning and purpose in their life, including their work life, where we spend at least half of our time, probably more, they live longer. And people connected to meaning and purpose in their life, whatever it is, in healthcare, it might be easier than some other industries and sectors, and their psychological and their physical well-being are better than people who don't have that connection. They live longer and they're happier.
And, you know, in healthcare, a lot of organizations are going towards RVU-based compensation or productivity compensation. And in one of your articles, you talked about that people that are in that kind of an environment have the highest occupational stress. And on the leadership side, I hear people talking about, well, this is a way to align the values of the organization with the work experience of the people that are the staff. And so it seems kind of positive from that perspective, from like a leadership perspective. But when you actually think about it from the staff's perspective, it might only feel positive. They think that they can get maybe more than what they are already getting, but then it leads to a lot of overwork, which then can lead to burnout. What do you think about that? You know, I get the no, what's that saying? No margin, no mission, or no mission, no margin. One of those directions, but like, what do you have any advice for healthcare organizations that use that productivity or are considering about using productivity as a basis for wages?
Well, it's hard because it's ingrained, and the vast majority of at least physicians in this country are on some sort of production model, and part of their compensation is productivity based. If you look at the science behind this, and there are decades of rock solid research, the worst thing you can do for a professional is to have their compensation be extrinsic reward. And so we know from dozens of studies throughout the whole work life area that it does bad things to humans. And within healthcare, there are much higher rates of professional burnout, emotional exhaustion, cynicism, depersonalization among physicians who are on production models compared to salary models. And so we know what the science shows. To me, and I'm not saying this is going to be easy for anybody to change, but we know that it's unhealthy for a number of reasons, including some of what you mentioned. And in a way, I think this may sound really harsh, but it's a lazy way to lead. And so the better way to lead is
I like that. That's a lazy way to lead.
because you just throw
Because
money at it.
you just sort of force people to be conforming in a way. And yeah, I like that.
Yeah, so I think you throw money at it instead of a conversation, and deep down, if you understand human motivation, and you know it's going to be harmful to them because they'll work too hard, or they end up. It depends on the organization how it's done, but often you end up being you and I end up being competitors instead of colleagues because we're not aligned that way. And so I don't want to overdwell on that, but because it's hard to change that, and that's our system. But it's a flaw in the system that the social scientists really understand. This has been described by DC and Ryan and Harlow and Maslow and Seligman for decades. Maybe the more positive way we can approach this is look at some of this job crafting space. It's still in this meaning and purpose area, but job crafting is the word for it in the research. I call it life crafting, but it's basically connecting, asking a colleague what's most meaningful to them at work, and giving them some time to reflect on that, because it often takes weeks and months to really figure out what it really is that they get is find most meaningful. Tate Shanafelt was at Mayo, and we co-led a lot of this work together 12, 15 years ago. And he did a study with, I think, 400 or 500 docs, and asked them what was the most meaningful part of their work. Was it quality improvement? Was it a patient with diabetes? Was it a Was it administrative work? Was it teaching nurses or whatever it was? Whatever it was, if they were doing at least 20% of their time, a day a week, on what they self-declared as most meaningful to them, they had half the rates of burnout.
Yeah, that's incredible.
And so then if we can't change the compensation system, we can look at what can we do to help the well-being of professionals by asking them what's most joyful to them, and looking at, we could change with whom they work, we can change how they work, we can change what they do, the proportion, and that, and if you're authentic in doing that as a leader, you actually bolster their morale to start with, because the single most powerful driver of well-being and likelihood to stay in 155 countries by Gallup surveys and across the world is, my supervisor cares about me as a person.
Mhm.
And I'd like to think those 5 behaviors, if are about caring about a colleague as a person. It's a very, and that's kindness. You're
Yeah.
trying to
Yeah.
help someone be better.
Yeah. Well, I'm always surprised at employees that just quit rather than talking to their supervisor about, these are the things that I'm unhappy with. And I wonder if some of our structures contribute to that. So like, we have job descriptions, we have salary levels, we have maybe not any clear ways for people to advance, like career pathways within certain fields. And then on top of that, then people feel locked in without really appreciating that within a workspace, there's lots of things that can be done and maybe aren't being done yet. I find this to be true, is that I have a lot of ideas about, we could do this, we could do that, we could do that. But I don't know who wants to do it. And so if somebody comes to me and they say, you know what, I really love teaching, I really love supervising the MAs or whatever, and maybe they don't even have to have it that well defined, but people coming to me and saying, you know what, this is an area that I'm really interested in. I lots of times, will then open my eyes up to, like, oh my gosh, there's a grant that's coming out in a few weeks. Let's apply for that grant so that we can see if you can do that. But it's almost like that creativity and flexibility. There's something about our systems that make people feel like they're cogs, and that they have no ability to affect change either for themselves personally or within the system. And for me, I think that having an organizational perspective of kindness and helping people do the things that they're really good at, or they like, or they feel like they want to learn and contribute, I think will also keep people working in healthcare and generating a lot of creativity versus just quitting.
Yeah. So I think no leader should ever be surprised that someone leaves. So ideally, you've got this relationship, this camaraderie with your group of colleagues, and most of the work group should be 8 to 12, and that's not 50, not 70, not 3 dozen. So that the manager, supervisor, leader can have a relationship that's meaningful, and have these conversations about what's meaningful to them and what they would like to do, and to have them be involved in co-creating the future with this collective decision making. And so I think that's a big part of it. So you're not surprised, and there's some turnover that is important and necessary, and for whatever, but you shouldn't be surprised about that, because you have a relationship with them and understand what's going on. So there's so many things you can do at that work unit level. We we had 3 randomized control trials with healthcare professionals that looked at the power of having a meal and a conversation with colleagues. And we, from Colin West, Tate Shanafelt, Cynthia Stonington, measured everything from cortisol levels in women physicians who were also mothers to emotional exhaustion and social isolation, positive feelings about the organization. And in all these randomized control trials with professionals, those that shared a meal and a conversation with them had off the charts better morale just from that act of breaking bread together. So, and you can do that organization wide with the program, or you can do that as a nurse manager or a nephrology chair or a supervisor of a team of home care nurses or whatever. Just simple things like that build this social connectedness of humans that helps us thrive at work, and probably the single most powerful driver of physical and mental health is social connectedness. And half of our lives are at work or more. So we should, that's the responsibility of leaders and organizations, is to connect people together in a shared purpose.
And Mary Jo Gregory, who's the CEO of the NARBA Institute, and I were just talking about that this morning, how post-pandemic, or even during the pandemic, we've all gone to so many more Zoom meetings, which on the one hand is very convenient. And you can get a lot of bridging across organizations for that, but you don't have that more random, informal bumping into people in the mailroom, in the hall, stopping by somebody's office and just reaching in and saying hi. And so we've lost a lot of that. So these commensality dinners, meetings, whatever, I think is one way that has been shown that we can improve those ways for people to connect together. And that is a value.
Yeah, exactly. So if you look at last 5 decades in America, we've become less happy, and our lifespans and health spans are shorter. And David Brooks wrote an interesting commentary in The Atlantic. We're becoming meaner than we were a generation ago. And part of it relates to what you're talking about, Teresa, where when we become, in the pandemic, it was happening before the pandemic, but the pandemic exacerbated it because we are spending less time face-to-face with all the oxytocin generating, experiences of shaking hands and just seeing someone over a meal or over at the coffee room, like you said. And so this is one of the values of a highly functioning organization. We bring people together from all different walks of life and income levels and colors and ethnicities and religion and gender. And we come together in this melting pot, whether you're having a DEI program or not. I'm not going to get into that. It happens naturally anyway. And when you do, it's better for the culture or organization and the culture of America, because we naturally, when we spend some time with people who are not exactly like us, our tolerance grows and our understanding grows. And the more we work remotely and the more we stay at home during the pandemic, we spend time with this homophily. We spend time with people who are like us, and that's good. It's a good thing. They're family and friends, but it takes away from another good thing of spending time with the beautiful diversity of America. And the more we don't do that, the more polarized we get, and maybe the more meaner we get. Yeah. And so that's part of our responsibility as leaders and organizations, is to bring people together and have our micro societies function in a very positive way to improve the social and physical and mental health of our staff, who are also citizens.
Well, I'm wondering too, if kindness might not and maybe this is a little controversial, be a way to bring spirituality into the workplace, because most Americans, at least now, are identifying as being spiritual but not religious. But even then, with most, I guess I can't think of any organized religion, where kindness is one of the basic tenets of it. And being able to express that within our workspace, like you said, we're spending more time at work and with the people that we work with than family members or friends. Although I do like to have friends at work. And so I'm wondering if this might be part of like the next evolution of us as a next evolution of humanity, or even, maybe America, United States, and a way to, an antidote to maybe some of the other mean-spiritedness that we see in the social media world.
Yeah, so our reason for being can be many things, and it could be multiple things in different ways. But part of it ideally involves our work life, and our reason for being, the meaning and purpose of that huge part of our life is a very spiritual thing. And if you end up being connected to your work as a calling, and so it's one of the 54 elements that drive health span and fulfillment. And if we have the spirit of kindness to helping other people do better, then so Paul Wellstone said before he died that we all do better when we all do better. And I think we've learned from the happiest, longest living, most fulfilled societies today, and from the organizations, when we care about the well-being of all the people on our team, that it's not only good for the people that we're helping be better and do better, it actually helps the whole organization. It helps us. So,
well, it certainly makes it more comfortable, I think, because when we give kindness, we have our own internal sensation of being well.
Yeah.
You can kind of tell in yourself, like if you say something unkind or mean or whatever, then, at least I do, I'll perseverate on it. Like, why did I say that? Did they really take it the wrong way? And it can bloom into this much bigger thing than if you just try to do the right thing from the beginning. It's much more relaxing ultimately.
Yeah.
And so then maybe organizations that codify it, maybe as part of their mission, vision, what's the other one? Mission, vision, strategy. No, I forget what those values. That might be ways that an organization tries to be explicit about it, in addition to doing these other projects. And we're almost to the end here. And so I want to be, if you could tell people like what your books are that they could learn more about this, and then also give a plug for the Arizona Wellbeing Collaborative and our Kindness and Leadership course that we're going to be rolling out with you, that will be available.
Yeah, I think we'll hope to announce that here in the next month or so, but we're looking at inviting at least 2 leaders from any organization and every organization in the state to work together and learn from each other in the spirit of all teach, all learn, on ways to we look at 2 things: those 5 leader behaviors and the listen, sort, empower, removing pebbles, basically asking people closest to the work, who know the work flow and challenges better than any supervisor or CEO, what it is that we can do to make our work better, that's within our sphere of control and it has high impact, and then empower them, giving them agency to make a difference. So we're looking to do something along those lines for a large collaborative this year.
That's awesome. Thank you so much for being so kind to us.
You're so kind, Teresa. It was really nice to visit with you. Thank you so much.
Yes, you too. Thank you so much. And thank you everybody who listened in. We appreciate it. If you want to get to complete our survey, there's a QR code up. And the next community grand rounds is with Dr. Terry Pipe on human flourishing. So thanks, everybody. Have a good day. Take care.